Let's discuss inquiring contents. First, the general approach and points of attention. It is essential that the physician is courteous and sympathetic to the patient's suffering. This is the only way to win the patient's trust, cooperation, and willingness to confide. Carrying out the inquiry with the utmost concentration and professional demeanor. Do not sigh or show any surprise or pessimistic attitude about the patient's condition. It is especially important to maintain a cool head if the patient is in critical condition or has a mental illness. Such a professional demeanor helps to reassure the patient. Second, the physician should focus initial attention on patient's chief complaint and make a deliberate inquiry about it. The inquiry should be comprehensive with emphasis on significant facts. As the story unfolds, encourage the patient where necessary to fill in the gaps. However, it is important to avoid pointed prompting or inducing the patient to say what you may wish to hear, as that may lead down to a wrong path and create an inconsistency between the history and the findings by the other methods of diagnosis. Number three, a patient in critical condition should be given immediate treatment after only a brief inquiry and examination. This helps to avoid any unnecessary delay in urgent treatment. A comprehensive and careful history and examination may be conducted when the patient's condition takes a favorable turn or it's stabilized. Number four, in inquiring process, simple language instead of medical terminology should be used. Be sure to catch the exact meaning of the patient dialect and slang and ask for clarification where there is any vagueness or ambiguity. Number five, if necessary, obtain the history or supplement it from the patient's companion or parents. Next is contents of inquiring. Number one, general data. This includes the patient's name, sex, age, matrimonial status, ethnicity, occupation, hometown, and address. All these are helpful for the physician to take responsibility of the patient, to write the case history, and to make the correct diagnosis. Number two, chief complaint. The chief complaint refers to those symptoms that cause the patient most distress. The symptoms and their course should be recorded separately from other symptoms. The chief complaint is the main reason for the patient to seek medical advice and serve as a guide to the correct diagnosis. Record the chief complaint in accurate and concise language without medical jargon. Thank you for your attention.